early on in my pregnancy. I was about 8 weeks along, and I went to the emergency room of my prior doctor, my prior OBGYN, and I was bleeding very heavily. There was also tissue, and I drove myself to the emergency room. I know that probably wasn't the best idea, but it wasn't very far from where we lived. And I got there, and they told me that I had dilated and that I was passing everything and that I was having a miscarriage. I wasn't given a full explanation as to what was happening to me. Why was I bleeding like that? The explanation I was given was, we just don't know. Some women do that. Well, that doesn't tell me anything. And so I knew that I was going to have to find someone else.
Stephanie came in mid-pregnancy, and she had some symptoms. They could have been serious, or they could have been very minor. The best thing you can do as a physician is to listen to the patient.
I was really surprised when I did find out that I had gestational diabetes, because I never would have known. And when they told me some of the symptoms that went along with it, I recognized what it was.
Gestational diabetes is very common in pregnancy. It is a disease that you're hearing more and more about. It can range from people that have it, having very large babies that are healthy, or it can even be a very danger of the pregnancy. So we want to know if anybody has diabetes.
I guess they usually take them earlier on in the pregnancy, and it's better to catch it earlier. But obviously I was with a different doctor. So another reason why I'm glad that I chose to find a different doctor, because if I didn't change to a different doctor, I never would have known, and I wouldn't have gotten the treatment that I needed.
A doctor can't always guarantee you a perfect outcome. I wish I could do that, but be honest with you, anybody ever tells you that, run away. Nobody on earth can promise you perfection. What I can promise patients is that, number one, I'm going to do my very best. I'm going to do my very best for you every moment of the day, every time. But number two, I'm going to be honest with you.
Because of gestational diabetes, you are at higher risk of a premature delivery. And so getting the care that I needed when I did probably stopped me from delivering even sooner than what I did. I thought I was having Braxton Hicks, but it wasn't. It went from 2 to 3 minutes apart to 1 to 2 minutes apart within 30 minutes. Before I knew it, they were on top of each other, and we knew we had to get to the hospital. I felt like I was about to deliver in the house. So when I got to the hospital, we got to the emergency room door, and they whisked me away quickly, very quickly, got me in a wheelchair and took me to labor and delivery it had to have been seconds.
If you come to our hospital and you're having a nice, pleasant, easy, gentle, safe delivery, that's fine. Stephanie was a little bit different. She had what's called a high-risk condition.
Dr. Sini came in. He had just enough time to check me, put his smock on, and he told me he was going to have to break my water.
She did happen to go into labor all at once, went into labor at home, and within 2 hours was here and delivered her baby.
Thankfully, I went to the right doctor and the right hospital at the right time, so that I was able to make sure that I had a healthy, normal pregnancy. Even though it was still a little bit premature, my baby was as healthy as she could possibly be, even though I had gestational diabetes. This is Audrey Noelle Washburn, and she is 4 weeks old on Tuesday, but she was born at 34 weeks, about 5.5 weeks premature.
There's a lot of good quality OB hospitals. In fact, I don't know of a bad hospital. But one thing our hospital does better is our personal care. Our nurses are one-on-one. Our lactation consultant helps people personally get through breastfeeding. I think you'll have a more wonderful, careful, bonding experience when you leave here.
Because you're not being treated like a patient, you're being treated like a person. Your child is not just the only focus, the whole family is the focus. And if there wasn't that factor, I wouldn't have chosen the Atrium. I would have continued my search looking for a doctor somewhere else. I think that because I was diagnosed when I was and got the treatment I did, it had made all the difference in the world.